You're watching ASH News TV. I'm Rachel Kopchak, and I'm joined by the current president, Dr. Ken Anderson. There are so many new FDA-approved drug therapies that are happening right now. What can you tell us about them, and how are they being featured here at the meeting?
Well, at the American Society of Hematology this year, there are, as you said, 20 new agents approved for management of blood disorders and blood cancers. There's never been a year like this ever. The FDA is coming, and actually we have several special sessions where they will chair and tell us how these drugs were developed and inform the best way to use them, make these new medicines really count for patients. We also have, both on the plenary session and in the late-breaking abstracts, new drugs that are not yet approved, but that are very exciting. We have a new kinase inhibitor for mastocytosis, sort of a follow-along drug for Gleevec in CML. We have combination therapies, many of them, but for example, venetoclax and ibrutinib in chronic lymphocytic leukemia, two novel agents achieving an incredible outcome. We have new therapies for hemophilia, long-acting agents that may ultimately cure some of these diseases. And we have CAR T cells, genetically programmed T cells in leukemia, lymphoma, and myeloma that are showing extraordinary response rates, even in far advanced patients who have no other options.
At ASH this year, you have to tell me, what has been your top highlight as the president?
Perhaps the highlight for me has been to learn the extraordinary things that ASH does, not only in our country, but all over the world, to bring the advances that we will hear about at this meeting, not only to patients in North America or Europe, but to patients all over the world.
Yes, and that is the goal of ASH, to bring hematology and conquer it worldwide. Thank you so much for your time. I'm Rachel Kopchak.